Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today, we'll be having a Q&A on immunizations and other topics for long-term care facilities. We have a panel of Quality Insights healthcare experts here today to review some new resources related to frequently asked questions. If you have questions to add to the conversation, you can drop those into the chat as well, or use the Q&A tool in your Zoom menu. If you would like to speak, you can request to be unmuted by raising your hand. And we invite you to join us every Wednesday for more webinars in this series. They're every Wednesday at 2 p.m. And I'd also like to invite everyone on today's call to let everybody on today's call know about a new grant opportunity that you can see here on the screen. Quality Insights is turning 50 this year, and to celebrate, we are offering $100,000 in grants to invest funding back in the communities we serve, including Pennsylvania and West Virginia. So if you or someone you know is involved in a not-for-profit health-related project, we encourage you to check out our website, qualityinsights.org/50webinar. And there you can find out rules for eligibility and how to sign up for our webinar on how to craft a competitive application. And that webinar will be next Tuesday, May 2nd at 2 p.m. And just a minute, I'm going to stop sharing that screen. And now I'd like to briefly introduce today's panelists. We have several of our quality improvement specialists here today. There's Deborah Wright, Penny Imes, and Shirley Sullivan, and Christopher Henry. And we're also joined by our infection preventionist Jennifer Brown. And instead of our usual question and answer format, Deborah and Jennifer are going to share a couple new resources. And if you have questions about these resources, about immunizations, or about any other topic related to long-term care, please share it in the chat. And Deb, you can get us started and share your screen if you need to.
All right, thanks, Kathy. So with this being National Immunization Week, we thought we would focus today's meeting on that. We're going to talk about, as always, some COVID updates, as well as flu and pneumo, and then share with you some new tools that we have coming out, and then open it up to any questions that you have that hopefully we can answer in regards to any of those vaccinations. So I know that many of you have been reaching out to us and asking us, what does it mean with the updated changes that the FDA has recently announced in regards to the COVID vaccines? So we want to try to keep this as simple as possible, because in our industry, there's so many different factors that play into it. So the FDA is stating that one administration of the updated bivalent vaccine is all that's needed to be considered up to date at this time. So even if you have a resident and or staff member that's never received any of the COVID vaccines, as long as they've received one bivalent, that's all that's needed at this point to be considered up to date. However, there's two big howevers with this, is we are still waiting to see the accompanying CDC recommendations. They met last week, and they are scheduled to meet again in June to further discuss the future of the COVID vaccinations. So that's one piece that we have to wait for further clarification. But then to add to the confusion even more is we need to wait to hear from NHSN as to when the reporting criteria will change. So just like we went through back in, what was it, November, somewhere in there, when we changed to the bivalent being considered up to date, that's where we're going to kind of have to be with this. So we're going to have to wait to see when their quarter is going to end. The last time that their quarter ended was March 26th. So we're already into April. So I'm thinking we're not going to see that up-to-date definition for our reporting criteria be effective until June. So hopefully by that time period, CDC, FDA, NHSN, all of the definitions will come together and they'll be matching. And I know that as we continue to go through May, we may have some confusion in regards to this. So we will continue to watch for updates and update you as we get more information, but the FDA has approved it. Now we're just waiting to hear from CDC and NHSN, and all of them come together on the same definition, which we're sure will happen, but we just have to wait for that final announcement to come out. With all of that being said, CMS's new threshold that they have set for facilities is they would like to see the resident COVID up-to-date vaccination rate hit 85%. We realize that that is a challenge, especially with new admissions and their belief that all these vaccinations aren't necessary, or they're of the generation that they don't believe in vaccines. So we understand that education is ongoing and it's challenging, and we're here to support you with that. If there's any support that you need, Jen has given us some great resources that we can share if you are truly struggling with how to approach those conversations, that we can share if you need that. Then in regards to the influenza vaccine, obviously the influenza administration, did I say that right? The influenza immunization is over, that time frame has passed. It is still important to make sure that you're getting the history. So if you're getting a new admission, it's not like, oh, well, we're not giving the influenza vaccine, so we don't really care what their history was. You still want to get that history. And the reason is, not only do you want to know what their vaccination status is, but you also want to make sure that the MDS is coded accurately. So one of the questions on the MDS is their influenza vaccination history. Did they receive it in your facility or outside of your facility? So you still want to make sure that you're getting that history so that you can accurately document the MDS, but also have an accurate reflection of those that are in your facility. Have they been vaccinated, whether it's at your building or outside of your building? So before we go into the pneumococcal, are there any questions in regards to the flu or COVID vaccines at this point? I don't see any in the chat.
Yeah, there's
So
none
if
in
you
the
do,
chat
like we
so
said,
far.
yeah, like Kathy said, if you have any questions throughout this, please just put it in the chat or raise your hand, and we will get to those. We do want to share with you, we've had some feedback. We've had our pneumococcal vaccination decision tree out there for a while, and we have had some feedback where people felt that it was difficult to read or difficult to understand or follow. So we kind of made one that it looks a little bit more busy, but it is a clear algorithm. So Kathy is going to put that on the screen so that we can just take a visual look at it and answer any questions that you have. If Kathy can throw that up there for us.
Sorry, Deb, I thought you were going to share it, so I have to take a minute to pull that up. There's a question in the Q&A right now, though, if you want to address it.
Okay. Our influenza vaccine expires in June, so we have still been administering to new admits. What is the deadline to stop administering? I'll let Jennifer correct me if I'm wrong, but it always has been the stop date was March 31st. But if your medical director has put something different into play, you would just want to make sure that you have a policy to cover continuing to give the influenza vaccine. Jen, do you have anything additional for that?
No, that's usually standard.
Okay. In the chat, so is a second bivalent not recommended for people 65 and over and are immunocompromised? So yes, that is one of the other recommendations, is that for those over 65 and immunocompromised, it is a recommendation. It is not required, though, to be considered up to date. So it would be something that would be a conversation between the facility and the physician to see if they want to administer that second bivalent and the timing of that. But they do not have to have that second one to be considered up to date.
Okay, I have that resource. If you're ready, I will share my screen.
Sure. So here's an algorithm that we created, and I think it'll be in the last minute load down in the next couple weeks. And you just start here, and it's like, has the resident received any pneumococcal vaccinations? And if no, you follow the simple the simple algorithm over here. The simplest way is to do the Prevnar 20, and then they're considered up to date. If your medical director or physician or resident prefers the 15, then a year later, it would be the pneumococcal 23, and then they're up to date. There's multiple paths that you can take based on a resident's previous pneumococcal vaccination history, and all of those different options are here that you can follow based, and then they can go in either direction. So it can be if they've had the 13, or maybe they've had the 23, you could follow it from the 13 down, or you can go backwards and it would still be the same thing. So as long as they've had what's in the path, that is what would make them up to date. And then we also put on here, we found a really great resource. You could either put it on your computer, you can put it on your phone. It's an app that can double check your pneumococcal vaccinations to determine what is the next dose, or are you considered up to date. So I actually know a facility that has been using this to double check. They determine if they're up to date, and then they put it into the app, they print it, and they make it part of the medical record to show that they have reconciled their pneumococcal vaccinations and determined whether they're up to date or not. So you can use this app in any way that you wish and that works for your facility, but we just wanted to make sure that we gave you that resource as well. So with that being said, I am going to turn it over to Jennifer Brown. Like Kathy said, she's our infection control nurse. She has created a wonderful immunization tracker, one like I've never seen before, and she's just going to give you a preview of it. At this time, we are trialing it with a couple facilities just to make sure all of our formulas, and you'll understand that when she shows you the worksheet that they work. And once we're happy with it, then we will make sure that all of you get that as you wish. So Jennifer.
Now, Deb, there's a question in here if you want to answer that real quick. Sorry to interrupt.
What is the time frame? How long year was before we assess for updated vaccine? I'm not sure I understand your question, Andrea. If you want to take yourself off of mute, and you can ask. And then
Okay,
Kathy, they're asking for the app in the chat room if you're able
They
to.
are. I will share that in a moment. I did give someone permission to unmute, but it was actually another person. So let's start with Andrea. Andrea, you can now unmute yourself to ask your question.
Hello. Is it still 5 years? Every 5 years they're eligible for a pneumococcal vaccine, or is that changed?
So that is kind of like the second bivalent vaccine. It is something that needs to be discussed with the physician, but it does not make them not up to date. That was a double negative. They do not have to have that vaccine in 5 years to be considered up to date. It is an option that can be discussed with the physician. Whether they have it or not, though, they would still be up to date.
Okay, thank you.
You're welcome. Misty?
Misty, you should be able to unmute yourself to ask your question now.
Okay, there you go. So, you talk about getting the percentages of fully vaccinated up above 85%. Here's my struggle. My struggle is we are partially, some of our people are skilled, which means they spend a long time here. A lot of our people are brand new admissions. They come in, some of them are here a week, some of them are here 6 weeks. The bivalent vaccine, though, once you puncture it, is only good for 12 hours. You get 6 doses. I hate to puncture it, open it, give 1 dose, and then I might not need another one for 4 days.
Right.
So then how would you suggest? So what I'm trying to do is wait until I have 5 or 6 people, sometimes even 4, and I'll put it out there for my employees. you know, so I could use the other two, but I would have to throw away a bottle every single day to vaccinate unvaccinated people as they come in.
And that, Misty, is going to have to be a facility protocol on what you do. I do know that there are some pharmacies that are working with the facilities, and maybe the pharmacy is the one that's opening that vial, but they are sending it to a multitude facilities in a 24-hour period. So if you have pharmacy A and pharmacy A services 15 other buildings, if you need one dose and facility B needs a dose and facility C needs a dose, they will draw it up and send it to the facility so that you're not wasting. So that is something you'd have to talk to your pharmacy about, or develop a facility protocol around that. But I understand exactly what you're saying.
And actually, this is Penny. Misty, I have a question too that maybe you can answer. I know some of my nursing homes, and honestly, like, I haven't determined whether it's their pharmacy or their resident population or whatever, who are able to get a single dose vial. Are you able to do that? Is that something that's actually can happen? They're out there. I just don't know what the criteria or protocol is for getting it.
And I did talk to my pharmacy, and they said that they do not have anything that's a single dose. Like my Pneumo 20s come in a single dose syringe. So as soon as somebody comes in, if they don't have their Pneumovac, boom, they get vaccinated. I could do that with my regular residents, no problem, because on admission, we have them sign a thing that not only states, I would like the vaccination, but it states, I would like to remain up to date. So that covers us, do you know what I mean, for another vaccination if we had to give it. But I can't do it because once I pop that bottle, I need 5 more people.
So you may want to talk to your pharmacy to see if they can be the ones to open a multi-dose vial and then create something within the population that they serve, that then they would label the syringes and send them to multiple facilities so that you're not wasting any doses. That may be your other option.
And I'll try to get more information too about the single dose vials that you could share with your pharmacy. You know, I don't know if there's that option for them to get. I know that would be ideal. I don't know what the criteria is, so I'm not, but I'll reach out to my nursing homes that I talked to that were able to get it and find out what they did.
Perfect, thank you, because I could probably be at 90% if I can get a single dose vial.
And that's what we're supposed to do. You know, CMS wants us to find out what your barriers are and to address those barriers. So, you know, that's one of the things, if we can figure out, you know, is there a way for everybody to have access to these single dose vials? And that might make it realistic, because you can't do the clinics anymore. You have too many people vaccinated. So, okay, well, thanks for bringing that up. That's really helpful.
All right, so I think we'll turn it over to Jennifer so she can share this wonderful resource.
Okay, good afternoon, everyone. So Equality Insights has identified through discussions with different facilities that, you know, one of the barriers is not being able to capture some of the vaccinations for pneumococcal and influenza. So what we've done is developed a spreadsheet to help with tracking. So this spreadsheet is designed to log and track pneumococcal and influenza vaccinations in facilities. It's specifically formulated to track pneumococcal vaccinations and influenza for residents over the age of 65. So it follows the CDC recommendations for administration of pneumococcal vaccines and influenza vaccines. And I'm going to try to share my screen here so you can see the spreadsheet.
You had it for a second there.
Okay, it's still good? Okay.
Yeah.
All right, so this is the spreadsheet here. When you open up the file, it has directions on how to use the spreadsheet, and it's pretty straightforward. We're going to select the vaccine to track from the tabs down here. One of the main things that you'll need to remember is none of the formulas will work unless the name is in there. So we'll just start with the pneumococcal vaccination tracker here. And I'm just gonna, okay, so this is the columns that we have here. We have the resident name, their date of birth, which comes into play with some of the vaccines, their floor, unit, room number, and the different types of pneumococcal vaccines available. So we're just going to start pretty straightforward. I'm just going to put Jane Doe, and date of birth. We'll pick something, and then put a room number and floor and room number. Okay, so Jane Doe got the PCV 20, and we'll have that pretty recently. Put it for 4/1/23. Once we enter the PCV 20, we have her up to date, the PCV 20. However, these other vaccinations are not showing as up to date. So what we can do is say that she declined the PCV 15 because she got the PCV 20, and that'll gray out the column for that. And as you continue to enter in residents, it'll give you a visual cue if they are up to date. If they're not up to date, it'll show as red. And if they are up to date, it'll show as green. And if we, say that they declined because of, various different reasons, we have lots of different options here. If there's a medical contraindication, they're concerned about the side effects. They've said, oh, I don't think I need that. My doctor said I don't need it, so I'm not going to get it. Or there's an option for other, if there's a reason that they declined it that is not on the list, and you can just write a note in the notes column for that reason. So I'm just going to try a different resident. We're going to do maybe John Doe. And we'll have him the date of birth in here. We have him on the first floor as well. And we'll give him a scenario where he had a PCV 15 first. And let's put it in last year. So because it's been over a year since he's had that PCV 15, he's eligible for another dose of either the PCV 20 or the PPSV 23. So if you see if it is as it stands, they're both red here because he's not up to date anymore. So that'll give you a visual cue that something needs to happen. We need to put in some data. We need to give him the vaccine, or something is wrong here. So we need to look at that column here. So he is eligible for another vaccine. So let's say that he's going to get the PPSV 23 today. And now he's up to date. And because he got that and he's up to date with that, we're going to say that, the PCV 20 is declined. And that grays out that column. And we're going to say that he started with the PCV 15 series, and then that row is good to go. So let's say we had another resident, Mary Smith, who received a PCV 13 before she turned 65. So let's give her. Okay. And she's on the second floor. Okay. So she had the PCV 13 back in 2018. So it's been over 5 years since she's had that. And so we see here that the columns are red here for our up-to-dates. So let's give her another dose of the PPSV 23 today. Okay. And so now this resident is up to date. Or you could, and then you can decline the other vaccines on here to grade those out. And put your reasons there. So, that's how we formulated the spreadsheet to track pneumococcal vaccinations. We did share this file with a few facilities to trial it and, play with it a little bit and see if there's, and we've already identified some things we can improve on, but, this will be coming out shortly. The second tab in this spreadsheet is for influenza tracking, and it is based on the current flu season begin date. So this date can be changed based on the year that you're tracking it for. So right now it's set to 7/1/22. And we just do the same thing as we did in the pneumococcal spreadsheet. We'll just put a resident name here. And okay, and put their demographic information here, and we'll put their vaccination date. Let's say that he got it. Oh. And that'll turn his column green. We do also have a place to track where they got the vaccination. So if they got it in the facility, or if they're a new admit and they got it outside of the facility, or if they've declined. So it has, a section here for whether or not they declined and the reason for declining. If there was a medical contraindication, concerned about side effects, perceived low risks, arrived outside of the flu season, allergy, and you can put a note here about what allergy they have, against the religious beliefs, or not eligible. And you can write any notes expanding on that. So this is the spreadsheet that we have developed here. Does anyone have any questions about the tracker?
There's no questions about the tracker so far. There was someone asking if we could share it with them. We cannot at this time because it is currently being tested.
Yeah, we have a trial group that is testing it out, making sure that it's good for everyone. And, we work out all the kinks before we spread it out to the wider group, but it should be available in the very near future for everyone to download. And
Yeah, we
one
want to
thing-
share. Oh, I'm sorry.
Well,
I just wanted to say, we want to share with everyone that as a quality improvement organization, we follow the QI process. And so when we develop something, the next step is we're running our PDSA cycle. So we're trialing it with a small group. to figure out what the problems might be. And then we'll move on to decide, do we adapt it, adopt it, or scrap it and start over? And what we're finding so far with this is we just need to make a few adaptions. And as we said, short cycles, have some people trial it for us and make sure we get all the kinks worked out, and then we'll be able to share it with everybody.
And I just wanted to point out what's really great, and I probably gave Jen a couple ulcers over some of these questions, but you know, this is such a unique spreadsheet and in a unique way that we can track it. We just wanted to make sure that we were giving you everything that you could possibly need for every report that you do. So not only just tracking up to date, but we all know how time consuming and stress related it is when we get that annual influenza and pneumococcal survey that we have to do. This will allow you, like if you go to that influenza spreadsheet and you want to filter by how many people received the vaccine in your facility, you can change that filter and say, I only want to look at the people that said they received them in our building and what is the count? Or I want to know how many refused due to religious beliefs, or I want to know how many received the influenza outside of my facility. You can filter by all of that and get your numbers so quickly. So if this is a tracker that you go to use, I just highly recommend that you do it for all admissions, whether they're in your building 24 hours or they're in your building for the whole year, because then when you go to do that annual vaccination survey that you have to do, you really use all of your filter options to get those answers much more quickly than what we're probably getting them now. So there was a lot of thought put in it, and Jen's theory on this color coding is really good. And like we said, we're just working out the kinks with a couple, if this, then that, so that the colors change to the right way.
Yep.
So it is 2:30. Is there any other questions that anyone has in regards to immunizations?
And remember, you can also raise your hand if you would like to ask your question out loud. By the way, we will be sharing these resources in our newsletter that goes out every Friday called the Last Minute Lowdown. So keep your eye on that. If you're not currently signed up, you can email me to sign up. My email is ccaudil@qualityinsights.org. And we'll be posting these resources there over the coming weeks.
So there is a
It's not
question in the
every
chat,
Friday.
the new influenza, NHSN, CDC reporting, does this apply to both staff and residents? The new influenza NHSN is staff related, it's healthcare personnel, but you will still need to do your annual flu survey when that comes to the facility. I'm sure that'll still be in there. But the NHSN is strictly healthcare personnel.
Thank you. So we have another question that just popped in. Is NHSN staff flu vaccine required for LTC facilities?
The reporting is required, yes. So you have to report your healthcare personnel, your influenza.
They clarified the reporting of.
Yes. Yep. The reporting of the influenza is required for long-term care through NHSN. It's that additional module that needs to be opened within your NHSN that only the administrator is able to open. So if anybody is struggling with that or has challenges with that, you can reach out to one of us and we can help you figure out how to turn that on.
They said the survey you just mentioned, is that for LTCs as well?
Yes. Yeah, for long-term care. Yep.
And I just posted my email in the chat again. If you want to receive the newsletter, someone else commented asking for that.
All right, well, if you have any other immunization questions that come up, you can just feel free to reach out to one of us at any time and we'll be happy to help you with that.
And if it's all right, I'll run us through some closing items. It seems like we're running out of questions here and we're getting close to the end of time. Let's see. Okay, so again, I'd like to invite everyone to next week's webinars. Did I mute myself? Sorry, I clicked on myself and I was afraid I did. Again, we'd like to invite everyone to join us every week for this webinar series. They will be every Wednesday at 2 p.m. And we also, if you have questions, invite you to attend our office hours virtual live chats, which are every Tuesday and Thursday. Deborah Wright is on those calls each week to answer questions on topics like quality improvement initiatives, infection control, or MDS coding or immunizations. And you can find the links to those live chats and webinars in our newsletter, which I mentioned earlier. It goes out every Friday and it's called the Last Minute Lowdown. And if you would like to receive that newsletter, but don't think you're on the mailing list, you can contact me at caudill@qualityinsights.org and I can get you on the email list. And my email is in the chat, and it will also be in an email that I will send to everybody later this week. I will be sending the recording and any related links to everybody this Friday. And so you'll have my email that way too, if you didn't get a chance to jot it down today. And I do not see any more questions or any raised hands, and there's nothing in the Q&A, so I think we can wrap up. I'd like to thank all of our panelists for joining us today, and I'd like to thank everybody here for joining us today and for all your great questions.